Imagine you're walking down the aisle of a drugstore looking for some medicine for your sore throat. Just when you thought you found the right product, another one catches your eye. Confused, you try browsing the internet, looking up your symptoms and searching for the best over-the-counter medication. You even ask an employee near you for help, but you still can't decide. How do you know which option to choose? Should you trust the internet's recommendation or that of the pharmacy worker? Your ability to confidently answer questions like these is health literacy in action. Health literacy is the combination of knowledge and skills that helps you make positive choices about your health. Things like knowing when to get medical care, selecting a cold medicine, calculating how much salt is in your meal, or identifying trusted and credible health information. But health literacy is not just about the individual. It is also about the people and organizations that provide health information and services. In a perfect world, institutions like governments, schools, and health centers would help us find, understand, and use information to make the best health decisions for ourselves and our loved ones. But when this doesn't happen, health literacy can help. Why is health literacy so important? People with health literacy are more likely to understand their medical conditions, to access screening and prevention services such as getting a mammogram or immunizations, and to take their medications as directed. Additionally, health literacy can decrease your risk of illness and prevent premature death. On a larger scale, improving health literacy could prevent nearly 1 million hospital visits annually in the United States alone. Your health literacy changes over time and is impacted by who you are and how you engage with the complexities of the healthcare system. Although someone might have the reading, writing, social skills, and critical thinking skills required for health literacy, they might still struggle with applying these skills because the healthcare system is complex. Only about 1 out of 10 adult Americans has the basic skills needed to function effectively in our healthcare system, like knowing how to take a medication, read a pamphlet, and understand why they should get tested for a disease even if they do not have any symptoms. Healthcare providers also have a responsibility to help patients understand their health. They can use simple language and explain medical concepts slowly and clearly using words and illustrations to communicate complex information. They can help boost their patients' health literacy by using the Teach Back method during a clinical visit. Teach Back means that the clinician compassionately asks the patient and their caregivers to repeat what was just said in their own words until all parties agree on next steps. Health literacy is a team effort, requiring a deeper understanding of individual and community values and beliefs. For instance, Messengers for Health, an indigenous organization in Montana, uses the tribe's shared values and trains Apsaloka individuals as community health workers to serve fellow community members living on the reservation. Hip Hop Health is a community-based initiative in New York that uses a combination of hip-hop music and cartoons to teach school-aged children about recognizing and understanding symptoms of a stroke. Even science animations, like the SciTunes video you're watching now, can help with health literacy. A recent study found that people with limited health literacy had more positive attitudes and higher information recall with animations with spoken text compared to illustrations. What can you do to put your health literacy into action? Before a healthcare visit, create a list of your symptoms, medications, or any questions that you might have. If possible, bring along an advocate, a trusted person who can act as a second set of eyes and ears and speak up if your concerns are not being addressed. After your visit, explore your online patient portal to learn about your care, read visit summaries to verify that they are accurate, and communicate any changes, updates, or inaccuracies to your care team. Now that you've had a glimpse into health literacy, you have a better sense of skills needed to navigate a drugstore and other healthcare environments. Improving our health literacy allows us to make more informed health decisions with confidence, making it easier to win at life.
To continue learning more about the world around you, check out our previous SiteTunes videos. You can also stay tuned about our upcoming projects by following us on Facebook, Instagram, and Twitter.